Welcome. Welcome to rpay.org. This is Consumers Dr.Vangala. I've been talking quite a bit on the healthcare. If you guys like what I'm saying, please do subscribe. This is a non-profit organization, and the goal is to educate the audience who's listening to this so-called account-based healthcare, which is consumer-driven. Guys, you really need to subscribe and share so that people can. It will help me a lot in telling what I'm supposed to do on the healthcare point of view for a consumer. Today's topic is participating insurers. Participating insurers. Let's define a participating insurer. It is a licensed health insurance company that voluntarily chooses to join a network of insurers working in compliance with principles of personalized health insurance and in agreement with health review authority. I'll go in detail in regards to the health review authority. It is truly a voluntary system, folks, for insurance companies. It's a voluntary system. Individuals, employers, insurers are not compelled to get or provide health insurance. It is purely voluntary. Individuals are free to be uninsured. Yes, free to be uninsured, but will have tax consequences for that choice. They will lose their deductions if they're uninsured. Insurers are not required to sign up with health review authority. They're not required to sign up for the health review authority and have an access to the impaired health support plans. Insurers choosing not to participate will fail to have a significant market advantages of personalized health insurance. They fail to have significant market advantages, so-called for personalized, so-called consumer-driven health insurance. Here are the two main reasons why insurers voluntarily participate in the consumer-driven healthcare and accept the decisions of the health review authority. And recognize the certificate of guaranteed coverage, folks. Certificate of guaranteed coverage. First, participating insurers can apply to the health review authority for individuals or small group employees, including family members, who are determined to have serious medical concerns and are uninsurable. That is, these persons are at risk for higher cost for health conditions. Insurers, if accepted into the impaired health support group, the insurers are then relieved of any potential claims for these individuals. They're relieved of any potential claims for these individuals. Second, participating insurers can have a second bite at an Apple at first renewal of a small group plan. That is, plan members who experience a significant deterioration in health or by accident can apply for a coverage in the impaired health support coverage. Once the individual or a plan member is accepted into the impaired health support coverage, the participating insurers will not have any further financial responsibility for the claims on that individual. You see, this segmentation of risk will lower the premiums for the remaining individuals and in small groups by 15 to 20%, folks, 15 to 20%. Participating insurers must have license to sell insurance products in the state they are operating in. And insurers must agree to offer both fully insured individuals and small group plans. They must accept the decisions of Health Review Authority and accept any certificate of guaranteed coverage presented to them. I'll take you through a format. Let's say different scenarios. Number one, is the insurer participating in the impaired health support coverage voluntary? Is it voluntary? Yes, for insurers or insurance companies. Instead of a mandate or penalties, insurers will find a significant pricing and market share advantages to voluntary participation. Only participating insurers will have access to the impaired health support plans. Only for participating insurers, for both eligible group members and to the individual applications. Next, what type of insurers are eligible to provide coverage in the impaired health support coverage? What type of insurers? Any participating insurers authorized to transact accident and sickness insurance, business in a state, any non-profit medical service corporation, any non-profit health service corporation. I'll repeat again. What type of insurers are eligible to provide coverage? What type of insurance companies are eligible to provide coverage? This says any participating insurance company authorized to transact accident and sickness insurance business in a state, and any non-profit medical service corporation, any non-profit hospital service corporation, any healthcare plan, and any health maintenance organization authorized to transact business in a state. So these are the different types of insurers. What are the insurer's obligations as a participant in the impaired health coverage, you may ask? Insurers must agree to participate for both fully insured small group members and individual applicants. Participating insurers must accept the determinations by the Health Review Authority of uninsurable and insurable decisions. Insurable decisions for small group plan members and individuals. How will impaired health support coverage affect insurers' underwriting? An insurer's participation in the personalized health insurance reform program will not change or impose or impinge on any insurer's ability to set or use individual or group underwriting standards as defined by each insurer. Yes, as each insurer. Over time, however, an insurer is likely to voluntarily adjust its risk selection process to minimize the required acceptance of those coming to them with certificate of guaranteed coverage. Why would an insurer voluntarily participate with Health Review Authority, you may ask? Well, insurers participating with the Health Review Authority will be able to offer individual and fully insured employer-sponsored group plans that have a significant lower premiums, and insurers will gain market share by covering more individual lives after segmenting risks into impaired health support plans. Any insurer not participating will be at a significant disadvantage with higher priced, fully insured small group plans, expensive individual policies, and a loss of market share. Loss of market share for the insurance companies. Can insurers terminate after joining impaired health support plans? Can they terminate? Yes. Insurers can terminate the agreement with Health Review Authority with at least 180 days of notification. Insurers will retain coverage for those lives covered while under the contract to the impaired health support coverage. Health Review Authority can immediately suspend or terminate the agreement with an insurer if the insurer fails to meet participating standards. In conclusion, folks, insurers who voluntarily participate with Health Review Authority and accept certificate of guaranteed coverage will have a market share and pricing advantages for both individual and small group policies. See, this is where the advantage is, by participation. And it is purely voluntary, folks, purely voluntary. I hope I can convey the message to you guys. If you like this channel, subscribe, share, and make some comment, folks. I would like to see you in the next segment of rpay.org, which stands for Reimbursement Premium Adjusted Yields. This is Consumers Dr. Vangala. Goodbye, God bless, and salute.